Hey, what's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at HAIRLICIOUSLY.com to purchase our microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo and serum, hair growth vitamins, and a few other products to help those who are losing hair. So in today's video, I wanted to share with you my hair loss treatment regimen. There's been quite a few of you who have reached out to me and basically been asking me what my exact hair loss treatment stack is. As you guys know, I started this whole hair transplant and hair loss journey back in November of 2016. I went to Motion Clinic in South Korea to get my first hair transplant. And since then, I have been taking hair loss medications to stop or slow down the progression of androgenic alopecia. Just because I've had a hair transplant or two doesn't mean that I don't have to be proactive about taking hair loss medications, because the truth is the native hairs, behind the transplanted areas are still going to be susceptible to miniaturization. Hair loss caused by androgens, DHT, testosterone, is progressive by its very nature. And for most people who are losing hair, they have to, be on hair loss treatments to really slow down their hair loss. There is a small percentage of hair loss sufferers who may get by without having to rely on any treatments. But, the average Joe, the majority of the people have to get on medication to really slow down further progression of hair loss. There's also, like I said, a small percentage of people who don't respond to treatment and continue to experience hair loss. But the average person who is suffering from genetic hair loss, hair loss medications will at the very minimum slow down hair loss and be effective in the majority of users. So my first line of defense that I have been taking for the past few years now is none other than Finasteride. I'm sure you guys all know about Finasteride, but basically it's a 5-alpha reductase inhibitor that blocks the conversion of testosterone into DHT, and it lowers serum DHT levels by about 70%. I personally use a generic brand under the name Acar, and I pay around $30 for a 1-month supply using my health insurance. Honestly, I don't even think that there is much of a difference from one brand to the other, in case you guys were wondering. But anyway, Finasteride will block DHT effectively, but at the same time, it's also going to increase circulating levels of testosterone, which then is going to be peripherally aromatized to estrogens. This can be a problem for some people because testosterone also causes androgenic side effects, just to a lesser extent than DHT. DHT is several times more androgenic than testosterone, and it will obviously be worse for your hair. But testosterone, believe it or not, still has androgenic activity, which means that it can still cause androgenic alopecia and also needs to be addressed as well. It's not going to affect your hair to the same extent as DHT, and that's why a lot of people are just able to get by, with Finasteride or even dutasteride. If you're highly sensitive with a high affinity to miniaturization via androgens, you are likely to still continue to lose hair from free testosterone that is still circulating in your system, let alone the remnants of DHT that's left over, despite being on Finasteride or even dutasteride. Dutasteride is going to wipe out nearly all of your DHT levels. And, for Finasteride, you will still have about 30% of systemic DHT that is not accounted for. But in my case, personally, I'm very thankful because I haven't really noticed any further hair loss after hopping on Finasteride 0.5 milligram per day, which means that, I'm not that sensitive as other individuals who have a higher affinity to miniaturization via androgens. And the reason why, in case you guys are wondering why I'm taking 0.5 milligrams of Finasteride versus 1 milligram, is that the DHT inhibition for both dosages are relatively negligible. So there really is no point in me taking a larger dose to get the job done. And hopefully this will never happen to me, but if I do continue to miniaturize later down the road despite being on Finasteride, I will have to consider jumping on dutasteride to block most of my systemic DHT to see if that's going to halt further hair loss. And if it doesn't, that means that I would have to start looking for an anti-androgen to inhibit the androgens circulating in my system from binding to and miniaturizing hair follicles. I think the most logical choice for me will be clascoterone, which goes by the name Breezula or CB0301, and it's currently undergoing clinical trials by the FDA for further approval in treating androgenic alopecia. The good news is that we already have clascoterone under the brand name Winlevi, and that was approved for the treatment of acne. So I feel more optimistic that Breezula will also get FDA approval since it's just a stronger dose than Winlevi. There's also RU584-1, which I've talked about in prior videos. But my main reason for not hopping on RU, long story short, is because there is a lack of studies and hasn't gone through the FDA approval process. The effects of long-term use is still unknown, and I just don't feel comfortable using an experimental drug that really isn't backed up with full clinical studies. My second and third line of defense is topical minoxidil 5%. Minoxidil is a growth stimulant and works as a vasodilator. It helps widen up the blood vessels and potassium channels, which in turn is going to increase more blood and oxygen and nutrients into the hair follicles. I use this in conjunction with microneedling once a week using my Dr. Pen A6, which is set at a needle length of 1.5 millimeters. I've already done tons of videos on this, on the efficacy of microneedling with minoxidil in helping promote hair growth. All of the studies that I've seen online on microneedling with minoxidil show better density improvement and hair growth. So it's highly recommended that if you guys are considering minoxidil to just throw in microneedling as well. Not only does microneedling help with topical absorption, but studies do indicate that it also evokes growth factors, which help promote new blood vessels and promote hair follicle proliferation. As far as minoxidil, I use Costco's Kirkland brand. I use their foam version. I like it way more than the liquid version. Cost-wise, it's about $50 USD for a 6-month supply. It's less messy, it dries up a lot quicker, and it's not greasy. I've actually had some side effects from using the liquid version when I was trying to grow my eyebrows. The liquid version does contain PG. The foam version doesn't contain PG. A lot of people who are allergic should stay away from the from the liquid version. But basically, after washing my hair with shampoo, I apply foam minoxidil, rub it in the areas where my hairline and temples are, let it dry for a few minutes, and then I style my hair and just go about my day. I will recommend to apply minoxidil twice a day, but honestly, I really haven't done that, the whole time. There's times when I just apply it once a day. But I do wait 12 hours after applying minoxidil to use microneedling because some people do get side effects, since it can go systemic after, microneedling. Others seem to be okay after, minoxidil and just, microneedling or minoxidil right after. So it really depends on how your body reacts to it. Now, moving on, I also use my DHT Blocker shampoo and conditioner. A lot of the shampoos that we see out in the market contain a lot of harmful chemicals and preservatives, including, parabens, SLS, sulfates, which can strip the oils from the scalp. It can cause your hair to dry out and break, and it can also cause, for some people, scalp irritations. So I really wanted to come up with a good shampoo and conditioner that is jam-packed with a lot of essential ingredients and something that doesn't contain any of the harsh ingredients and something that is going to help maintain healthy hair growth. I also find that my shampoo does help remove a lot of sebum and debris that's caked on the scalp. It lathers well, and it also smells like coffee. And most of my viewers who are using my shampoo seem to really love it. The conditioner helps as well, especially if you guys have longer hair. It helps prevent, dryness, frizziness, and damaged hairs, and it's also formulated with ingredients that help inhibit DHT. I will say that it is very important that you guys practice good scalp hygiene and good care. Because anytime you're applying any type of topical products on your scalp, things like minoxidil, topical finasteride, topical anti-androgens, it's important that you guys get rid of any sebum or dandruff that's caked on the scalp, since it can affect the way that it's being absorbed properly. And it's not rocket science, because if you have a lot of crap that's on top of your scalp, it's going to definitely hinder and prevent whatever you're applying on your scalp from working properly. So really invest in a good shampoo. I'm not necessarily saying that you guys have to get mine. If you find one that's free of parabens, that has really good ingredients, take good care of your scalp, and your scalp is going to thank you in the long run. Now, the next hair loss treatment regimen I use is vitamin D. I just get the generic Walmart brand and take about 3,000 IUs once a day. Regardless of hair loss, I think most people need to take vitamin D since they don't really get enough, and there's strong evidence that vitamin D exerts an anti-inflammatory and immunoregulatory effect. And more so for hair purposes, vitamin D is known to modulate growth and differentiation of keratinocytes through binding to the nuclear vitamin D receptor. Vitamin D deficiency was also highly prevalent in patients with androgenetic alopecia. But that's not to say that there are clear correlations between the extent of hair loss and different vitamin D levels. But even for, just health purposes, there is a well-established causal connection between vitamin D deficiency and some autoimmune diseases. So it's always worth making sure that your vitamin Ds are up to par. And finally, probably this is one of the more controversial treatments for treating hair loss that I use on a daily basis or on a weekly basis is low-level laser therapy CAP. There's a lot of skeptics around the use of lasers for treating hair loss and its efficacy, but there are also studies too with controlled clinical trials that demonstrated that low-level laser therapy stimulated hair growth in both men and women. The main mechanism is hypothesized to be stimulation of epidermal stem cells in the hair follicle stem cell bulge and shifting the hair follicles into the anagen phase. I obviously wouldn't recommend laser treatment solely as monotherapy, but if it's used in conjunction with other treatments, including microneedling and minoxidil, finasteride, dutasteride, anti-androgens, I think there would obviously be an advantage since you're combining treatments that work in different mechanisms of action to promote hair growth. And actually, there was a study that showed better hair density and hair diameter when low-level laser therapy was used in conjunction with minoxidil 5%. The one that I use has 272 laser diodes set at a wavelength of 650 nanometers. It doesn't contain any LEDs. I know that there are other laser caps that utilize both lasers and LEDs, but lasers, they're much more powerful in terms of joules than LEDs, and this means deeper penetration into the scalp. And since LEDs are not, they're neither monochromatic nor coherent, they can't target this very specific wavelength, which means that their beams do not actually reach the hair follicle. There are various low-level laser therapy treatments, but the one that I use is non-pulsating. The lasers don't flicker on and off, and it only requires 7 minutes of treatment each session. I typically use it right before I go to bed or sometimes even right after microneedling, and I use it about 2 to 3 times a week. So there you have it, guys. The said treatments are the ones that I am utilizing to fight this hair loss journey. As you know, it has to be a lifetime commitment, and it really requires you to be consistent with the treatments. A lot of people sometimes tend to lose focus and they kind of slack off, which in turn is going to result in further progression of hair loss. So ultimately, it really comes down to you and how much you want to save your hair and just how much willing you are to be proactive to halt further hair loss in its tracks. Hair loss treatments can sometimes feel very redundant, and a lot of people don't like using it on a daily basis, but the way that I think is that it's no different than having to brush your teeth every day or taking your vitamins for the sake of your health. I will say that if you are losing hair, you have to get on treatment ASAP, because the faster you act, the more hairs that you guys are going to be able to save. Get on FDA-approved hair loss treatments like finasteride and minoxidil and even dutasteride. At the very minimum, I would recommend that you guys hop on finasteride or some 5-alpha reductase inhibitor. This will at least lower your systemic DHT level and hopefully reduce your hair loss. But that's all I have for today's video, guys. If you guys have any questions, make sure to leave me some comments, or you guys can reach me via email. I also do have a private one-to-one hair consultation. You guys can visit my website at hairliciously.com and sign up to schedule one. We can discuss anything from hair transplant doctor recommendations to treatment options. If you guys are also interested in scalp micropigmentation, I have a clinic out in Maryland. We work on all types of patients with varying degrees of hair loss. We do density fills for thinning individuals, including women. We can reconstruct the hairline, the temple points, and give you that buzz cut appearance. So thanks, guys, for all of your support, and I will talk to you guys in my next video. Take care.